There is a good chance that if you're watching this video, it's because you or someone you know is pregnant. If that's the case, congratulations! Hi, I'm Dr. Jennifer McCall, and I'm an OB-GYN at the Ottawa Hospital. This video will review some of the prenatal tests that a person may have during their pregnancy. First off, what is prenatal testing? Prenatal screening helps to detect potential health issues and genetic abnormalities in a baby before birth. These tests help expectant parents understand potential health risks and make informed decisions about their pregnancy. The most common conditions that prenatal testing helps to detect include Trisomy 21, or Down syndrome, which is characterized by an extra chromosome 21 and can lead to intellectual disabilities and developmental delays, Trisomy 18, or Edward syndrome, which involves an extra chromosome 18 and can lead to severe growth delays and organ malformations, and Trisomy 13, or Patau Syndrome, a condition that results from an extra chromosome 13 and causes severe neurological and physical abnormalities. And anatomical abnormalities, which is when an organ, such as the heart or spinal cord, doesn't form properly. When do prenatal tests take place during pregnancy? Prenatal tests are performed at various stages of the pregnancy. For first trimester screening, this includes blood tests and an ultrasound to measure the nuchal translucency, that is, the fluid at the back of the baby's neck. These tests usually occur between 19 and 14 weeks into the pregnancy. There are two types of blood test. There is the early first trimester screen, which is usually publicly funded in Canada, and non-invasive prenatal testing, which is more accurate but sometimes has to be paid for by the patient. Second trimester screening, also known as the quad screen, is usually performed between 14 and 20 weeks into the pregnancy. This is also a blood test. The anatomy ultrasound is an ultrasound usually performed in every pregnancy between 18 and 22 weeks. It can detect major anatomic abnormalities, for example, with the heart or the spinal cord. These tests are not perfectly accurate. If you get a result that detects no genetic or anatomic condition, most people feel relieved. You deserve to feel that relief and enjoy your pregnancy, but remember that prenatal screening cannot test for every disease. If you get a result that detects a genetic or anatomic abnormality, usually the next step is to do a confirmation test. It may involve another blood test, a chorionic villus sampling, or CVS, or an amniocentesis, which are tests that sample the placenta or amniotic fluid directly. Your healthcare provider will give you more information. An important thing to remember is that all of the testing discussed today is optional, including additional confirmatory testing. Once you have the results of the test, your care provider will likely discuss with you whether you want to continue the pregnancy or not. If not, they can recommend how to proceed. If you continue the pregnancy, they will be able to guide your care in the safest possible way for your baby, for example, with extra testing or support when the baby is born. Prenatal testing offers expectant parents crucial information about their baby's health. By understanding these tests, you can better prepare for the journey ahead and make informed decisions about your pregnancy. If you would like to learn more about prenatal testing or have any concerns about your pregnancy, reach out to your healthcare provider. Thank you for watching.